Are you feeling tired all the time? Struggling to stay focused? It could be more than just stress. It might be anemia, one of the most common yet overlooked health issues in the world. Hi everyone, have a great day. I am Dr. Kavya. In the last video, we had discussed about importance of iron in the body, daily requirements, iron-rich foods and meal ideas. Today we will be discussing on conditions related to iron, mainly about anemia. What is hemoglobin? Hemoglobin is a protein specifically adapted for oxygen transport. It is composed of four globin or the protein chains, each surrounding the iron-containing pigment molecule. What is the normal level of hemoglobin in our body? In adult men, it ranges by around 13.8 to 17.2 gram per deciliter, and in adult women, it ranges between 12.1 to 15.1 gram per deciliter, and in pregnant women, it ranges in 11 to 14 gram per deciliter, and these values may slightly vary based on the lab and the altitude. Now let's go through some disorders associated with iron. First one is hemochromatosis. What is hemochromatosis? It is a disorder where the body absorbs and stores too much iron. The excess iron builds up in our organs like liver, heart and pancreas, leading to damages over time. What is the cause for this? Mutation in specific genes that may lead to altered form of absorption in the body. Symptoms of hemochromatosis. So there may be fatigue, extreme tiredness, joint pain, skin darkening where the skin appears bronze or grey in tone, abdominal pain, liver enlargement or damage can lead to cirrhosis also, diabetes and bronze diabetic due to pancreatic damage, heart problems, shock, loss of libido or impotence. Symptoms often appear between ages of 30 to 60 years and are common and severe in men. And the management of this condition is based on the proper diagnosis and proper consultation of a medical expert. Next is anemia, the main discussion topic for today. Anemia refers to a state in which the level of hemoglobin in the blood is below the reference range with respect to the age and gender of the person. And the other factors including pregnancy and altitude of the place also affects the hemoglobin levels, and this might be taken into account when considering whether an individual is anemic. Around 30% of total world population is anemic, and half of these, some 600 million people, have iron deficiency. Other than iron deficiency anemia, here are a few types of other anemias like microcytic anemia, macrocytic anemia, megaloblastic anemia due to vitamin B12 and folic acid deficiency, sickle cell anemia which is a genetic condition, and anemia of chronic diseases caused or seen in kidney diseases, infections or cancer patients. Another common type of anemia after a iron deficiency anemia is hemolytic anemia, where there will be abnormal destruction of the RBCs and hemoglobin in our body. Now we will go through iron deficiency anemia, its possible causes, common symptoms, tests and managements. This iron deficiency anemia occurs when iron losses or the physiological requirements exceed absorption of the iron in the body. Most common cause for iron deficiency anemia is a blood loss in men, and postmenopausal women will be having gastric and intestinal diseases and hookworm infections like parasitic infestations are also common reason, and also long-term use of some drugs, certain kinds of drugs can also cause iron deficiency anemia. Another reason for iron deficiency anemia is the defective absorption of iron in our body. Different factors influences the proper intake of iron from our gut. We get around 7 mg of dietary iron from our 1000 kilocalorie of food. From this, more than 90% is non-heme iron from the plant sources and less than 10% is the heme iron. Within the gut, there are different factors that influences the iron release from the food and enhances the absorption. Gastric acid or our hydrochloric acid in our stomach is one of the major components that helps in releasing and keeping the iron in the soluble form. Through the intestinal surface, it absorbs to the blood with the help of a protein chemical known as hepcidin, which is secreted by our liver cells into our duodenum, that is the part of our small intestine. And vitamin C is another important factor for enhancing the iron absorption, which we have already mentioned in our previous video. From the available dietary iron, less than 50% iron is possibly absorbed and used for making different components in the body. Most common part is used for the synthesis of our hemoglobin, an oxygen and carbon dioxide carrying compound in our blood. Remaining part is used for our myoglobin synthesis and enzyme synthesis. Balanced iron will be stored in our body as ferritin. Another factor is increased physiological demand of iron. At times of rapid growth such as infancy and puberty, iron requirements increases, and pregnancy and breastfeeding also demands high amount of iron requirement per day. Most common signs and symptoms of iron deficiency anemia seen in patients are the patients may lack fatigue or weakness in the body, paleness or yellowishness of the skin, and the sclera, which is a white part of the eye. Also, the patient may feel shortness of breath and feel discomfort. Dizziness or lightheadedness can be there. Then cold hands and feet, rapid or irregular heartbeat, headaches can be seen, chest pain in severe cases, and craving for non-nutritive substances. There can also be signs like brittle or the weakness in the nails, soreness or swollen tongue, cracks at the corners of their mouth. How to find out if you have anemia? The proper diagnosis of the condition is the important thing. It's not easy with common people to self-diagnose, and they need an expert consultation with the doctor for the diagnosis of the condition. But if you are a medical professional and you got a little idea and you doubt about the anemia, and again a doctor's consultation is suitable than the self-treatment, because all the above mentioned signs and symptoms might not reflect in all kinds of people. Most common investigations for anemic conditions is to check the hemoglobin level in the blood. If the value of the hemoglobin is less than the preferred range, we can suspect anemia. If more detailed investigations such as blood iron level, RBC concentration and hemoglobin concentration is necessary, that will be prescribed by your doctor based on your health status. Next is how we can manage this iron deficiency anemia if you are diagnosed. Always remember the point, self-diagnosis and self-management or self-treatment is never recommended in any kind of health conditions. This is always decided by your doctor based on the exact reason behind the anemia. If your gut or intestinal blood loss or any other reasons related with defective absorption is the culprit, you should refer and consult with a specialist for getting the treatment. They should find out the reason for blood loss and correct it well with proper treatments. If imbalance in diet or increased physiological demand is the cause, you should consult a clinical dietitian or a nutritionist for the proper diet consultation. Moreover, diet is an important one to focus in this kind of situations. Do watch our previous video on iron to know more about iron-rich foods and meal ideas. Thank you for listening. Don't forget to subscribe for more health-related contents every week. Comment below if you suspect lack of iron in your diet. Until next time, stay healthy and keep tracking your iron